Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Host Eddie Frederick.
So glad you can join us. The World Health Organization has declared monkeypox a global health emergency. This story takes the lead in today's edition of Caribbean Perspective for Tuesday, 26th July 2022. Details when we return.
The hurricane season is now upon us, so we as Caribbean people need to remember to think safety and be prepared. Avoid venturing outside during a storm or hurricane, especially if there are strong winds. Rooftops and other debris are often blown about and can cause great damage.
Welcome back. The World Health Organization has declared the monkeypox virus a public health emergency of international concern. The rare designation was last given in 2020 for the spread of COVID-19 virus. So what does this now mean for Trinidad and Tobago? Health Minister Terence Dial Singh spoke with TV6 News, and reporter Cindy Raghubartika Singh tells us what we can expect.
16,000 cases and 5 deaths across more than 70 countries. A surge in the spread of the monkeypox virus led to the WHO declaring it a global health emergency of international concern, the organization's highest alert. The public announcement was made following an emergency meeting this morning. So how does this translate locally? Health Minister Terence Dial Singh says TNT has been planning for this particular virus over the last 3 months.
It means, therefore, that the 9 action plans that they have identified, we luckily and wisely did all of these things since May 20th, defining the case, training healthcare workers, designating a center which is Cora, and I've asked my colleague in Tobago to designate a similar facility in Tobago for isolation and treatment.
He says TNT has the testing and isolation capacities and mechanisms are in place for contact tracing. He adds that the government does not have any intention to impose travel restrictions.
There would be no travel restrictions because of monkeypox. And I think the Honorable Prime Minister made the right call. Remember, this monkeypox is not as transmissible as COVID, so you don't need to shut down a country. But we need to be aware, we need to be vigilant. I think now it's in over 70 countries with 16,000 cases and 5 deaths. So it's a very low case fatality ratio, and the 5 deaths are mainly on the African continent. But that should not lead us to be complacent.
Symptoms of the monkeypox virus include fever, rash, lesions that ooze and are painful with changes in color that may also grow in diameter, especially on genitalia. People observing these symptoms are asked to seek medical attention for treatment and testing. Minister Dial Singh is also giving this advice to the population.
And we just ask people to be very vigilant, especially with close skin-to-skin contact. That could happen in any situation, like during sex, intercourse, breastfeeding is close skin-to-skin contact. And there have been a couple of cases where babies have actually acquired the virus. So we urge people to avoid that close skin-to-skin contact with anyone from those 70 countries until you know that person's status.
Cindy Raghubartika Singh, TV6 News.
Still on Trinidad and Tobago, the opposition UNC says when the Prime Minister declared crime a public health issue earlier last week, it confirmed the government has no clue how to bring the spiraling crime rate under control. Speaking at the UNC's weekly Sunday morning press conference, Member of Parliament Rodney Charles also called on the government to respond to the alarming revelations made in a recent U.S. trafficking in persons report. Cindy Raghubartika Singh, again of TV6 News, reports.
Declaring crime a public health issue does little to nothing to address the immediate and long-term effects the current surge is having on this country. It's how MP Rodney Charles feels about this latest crime plan and committee being set up by the government.
How will this approach succeed when thousands of students will enter secondary schools in September, totally unprepared to succeed? When hundreds of Venezuelan migrant youths are not integrated into our society? When poverty is increasing daily, while guns are readily available? When income inequality is rising?
He says 7 years into government and multiple national security ministers later, Prime Minister Rowley continues to fail to clamp the frightening wave of serious crimes washing over TNT. Human trafficking, he adds, is another growing concern, as he made reference to the United States 2022 Trafficking in Persons report released recently.
To the U.S. report, this part of it says, and the government did not take action against senior government officials alleged in 2020 to be involved in human trafficking.
He urged the Prime Minister to do good by the people of Trinidad and Tobago and take the necessary action.
Who are these senior government officials alleged in 2020 to be involved in human trafficking? Who are they? Are they members of your cabinet, Dr. Rowley, or our protective services? Tell us why no action has been taken against them. And when does the government propose to take action against them so that Trinidad and Tobago will not be blacklisted?
Cindy Raghubartika Singh, TV6 News.
You're listening to Caribbean Perspective with Eddie Frederick.
Antigua and Barbuda's CMO speaks on local response to monkeypox.
Despite there being no confirmed cases of monkeypox in Antigua and Barbuda, the Health Ministry will be stepping up its surveillance of the virus. Chief Medical Officer Dr. Rhonda Seeley-Thomas says there have been 5 suspected cases so far, all of which have tested negative. The CMO says samples of suspected cases are presently being sent to the Caribbean Public Health Agency, or CARPHA, but the country in a matter of weeks will have the capacity for local testing.
Because of the COVID-19 outbreak and our preparations for COVID-19, we have the capacity to do tests with the DNA of viruses. And we have some of the reagents. We've done some of the actual procedures for monkeypox testing in Antigua at the Celestial Medical Center lab, and we're in the final stages of having that done.
The CMO says special attention is being placed at the country's ports of entry. Dr. Seeley-Thomas explains the current protocols in the event of a suspected case.
The person would be advised to isolate. We will start contact tracing, and we will try to identify those contacts and monitor them for symptoms. With regard to the person who would have been the suspected case, we would take samples. We have instructions to our healthcare providers for how the samples should be taken, what samples should be taken, how they should be transported. When we get those samples will be sent to the Caribbean Public Health Agency, CARPHA. But that person will remain in isolation for a maximum of 3 weeks until their symptoms subside.
The Chief Medical Officer also has this advice for the public.
They may be able to pick up monkeypox via that route. So the physical and social distances that we were practicing for COVID, I encourage persons to do that as much as possible. Wear their face mask as much as they can, particularly during the carnival season, because although we have not had any confirmed cases of monkeypox in Antigua and Barbuda, we have to be vigilant to try to prevent it from coming into Antigua, but if it is that it is here already, that to prevent its spread.
Rakib Aparisi reporting for ABS News.
The Minister of National Security of the Bahamas highlights strategies aimed at lessening criminal activity in the country. More in this ZNS News item.
Homicides continue to dominate the headlines this week. An 18-year-old was shot to death. Another victim was stabbed. And in instances like those, National Security Minister, the Honorable Wayne Munro, is hoping to curb the crime problem with the help of officials from the Royal Bahamas Defense Force.
The Vision 2040 is pointed out that we have to move with socializing people properly. We're looking at programs to address what we call youth at risk. And so currently, Lieutenant Commander Delvon Duncombe and the Royal Bahamas Defense Force are looking at a transition program to track young people moving from primary school to high school who may be off course, with a view to getting them into diversionary programs to try to get them back on course, and then tracking them from junior high school up, seeing have we redirected them, are they still on the path they were on, and if they are, then we will have to increase the intervention on that.
Well, he explained how, at the sidelines of the commissioning ceremony for the chapel at the Bahamas Department of Corrections Friday, Minister Munro shared why the current violent behavior needs to change.
The approach, if you would have looked at it, is we talk about reintegration here, we talk about rehabilitation here. That's a concept that you have departed from the norms that we expect of you. So stabbing people, that's not acceptable. Shooting people, that's not acceptable. Once you are now caught, you are brought here, and they call it program you. We have to program you now to be a responsible citizen, because clearly in your upbringing to that point, you didn't get it. You didn't get that you shouldn't be stabbing people, you shouldn't be shooting people.
Bermuda has become the latest Caribbean country to confirm a case of the monkeypox, while St. Lucia says it is monitoring 6 suspected cases to include 4 with no off-island travel history.
The Bermuda Ministry of Health is investigating potential close contacts of the patient, according to a spokeswoman on Thursday. The virus, which causes flu-like illnesses and a rash, has spread in a string of communities outside Africa since a cluster of infections was identified in Britain in early May. The ministry said in May that the island was on the alert for cases of the virus. Acting Health Minister in Bermuda, Jason Hayward, said in a statement that monkeypox is rare, not life-threatening, and Bermuda is well prepared to detect the disease and take suitable public health measures to prevent its spread. Hayward said that the ministry was working with the Trinidad-based Caribbean Public Health Agencies, CARFA, the Pan American Health Organization, PAHO, and the United Kingdom Health Security Agency. As of July 22, there have been 15,378 monkeypox virus cases reported in 71 countries.
The United States Department of State has an eye on St. Lucia for trafficking in persons.
St. Lucia has been placed on the Tier 2 watch list in the 2022 Trafficking in Persons TIP report published by the U.S. Department of State. The report said the government maintained minimal protection, law enforcement, and prevention efforts regarding human trafficking. However, the document said the government of St. Lucia does not fully meet the minimum standards for eliminating trafficking, but is making significant efforts. Additionally, it said these efforts included passing an amendment to remove the option for a fine instead of imprisonment. The report also pointed to increasing public awareness of the hotline to report trafficking and working with an international partner to investigate a potential child sex trafficking case. But the publication observed that the government did not demonstrate overall increase in efforts compared with the previous reporting period, even considering the impact of the COVID-19 pandemic on its anti-trafficking capacity.
The death penalty debate is joined by Jamaica's Minister of National Security, W.H.O, who is advocating against it. More in this television Jamaica News report.
Justice Minister W.H.O is siding with JFJ regarding the position on the death penalty. He agrees that it's not a deterrent to crime.
When the state uses violence, which is what the death penalty is, to solve a problem, the state thinks it has solved a problem. But it is using violence and telling people that is how we solve problems. And anyone who has studied capital punishment will know that the history of capital punishment was the perpetuation of a cycle of violence.
Investigations continue into a major gun find and ammunition find in St. James. It's reported that shortly after a man identified as Andre Young was killed on the Rose Hall Main Road, the police launched an operation in Lilliput in the parish. That's where the deceased man and his alleged attackers are from. The lawmen recovered more than 100 rounds of assorted ammunition, a multi-caliber rifle, and a 9mm pistol. Reports are that the man was shot by occupants traveling in a black Mercedes-Benz. The car then drove off in the direction of Trelawney.
Hubbard's Motor Department Mount Gay and Hubbard's Tire Bay, located at the Building Supplies Compound in Grand Anse, are reminding the motoring public that another round for licensing and inspection has begun. Just arrived on new shipments of quality furrowed and torque tires to fit all makes and models of vehicles at competitive pricing. Shop early to avoid the hassle of long lines. WhatsApp them on 473-405-5482. Hubbard's. Quality service, affordable prices.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.